Good morning. It is June the 16th of 2021. This is Dr. Beck here at LifePoint Medical, and we're busy, but we're not so busy we can't take care of you if you need us. So please call us if you feel like you're having a problem or something's going on that is you can't figure out medically wise, and we'll try to help you if we can. I wanted to talk about a clinical pearl this morning, something that I have to deal with on a daily basis is called asthma. And asthma is, by definition, your lungs hyperreacting to the environment. And the hallmark of asthma is wheezing, okay? And what happens in a cough is also coughing and wheezing are the two things people get with asthma, along with shortness of breath. Now, you can have asthma starting as a child. It can develop as a child, go away. It can develop as a child, go away, then come back as you get older. There's all different versions of the way asthma works, but it has to do with the sensitivity of your lungs and your body to the environment. So just quickly, I know lots of people have asthma. A lot of people know they have asthma because they hear themselves wheezing. However, if you're coughing all the time, and particularly at night you're waking yourself up coughing, there is a pretty good chance you may have asthma. And if you come and talk to us about it, we have a test we can do to see. Plus we do a clinical diagnosis. In other words, I listen to what you tell me, listen to your lungs, and then sometimes I can make that determination without any test. But we do have a test called a spirometry that we can do to confirm or whatever we need to do with asthma. We treat asthma. There's some medicines like montelukast or Singulair is one of the primary treatments for asthma. However, we also use our rescue inhalers, which is albuterol. And a lot of people know that word and have seen it or used it, and have these inhalers that we use for the albuterol. And albuterol is a rescue inhaler. In other words, it rescues you when you feel like you're locked down, and you take a couple of puffs of the albuterol and you open up and everything's fine. But that's not the best treatment for asthma. The best treatment of asthma is you take an inhaler every single day, and it keeps you from having to use the albuterol. Because we know every time you have an exacerbation or your lungs have an asthma attack, the next time is easier for your lungs to do that. So if somebody has asthma, and sometimes it can be well controlled, they don't need any medication. Sometimes it's seasonal. In other words, they don't really have asthma till the springtime or the fall. I have low-grade asthma personally, but it's usually not a problem, but it's definitely there. I know it's there. But if you have persistent asthma or you're having an exacerbation, we put you on a maintenance med. Now, these meds are ones you take every day, and they preclude the use of you needing the albuterol, and that's actually how we determine whether we're doing a good job or not, is how often do you need albuterol. So if you're wheezing, coughing, short of breath, and you feel that coming on, or you've had that problem and you can't understand it, come and talk to us, and we'll evaluate you and tell you all about asthma and try to figure out what's going on and get you better if we can. All right, as far as COVID, 1,574, that was the same as yesterday and the day before. And the day before, I think. But that's awesome. Please, let's keep it there. I'm tired of this virus. Otherwise, we got our Place of Hope meeting this afternoon, so I will be out of the office a little bit earlier, but it's very exciting to talk about everything that we're able to do in this community. And if you want to help with that, you're more than welcome to send a donation to Place of Hope, North Georgia, P.O. Box 933, Clayton, Georgia 30525. I'm a trustee in this organization. That means you got to trust people to use your money if you donate it appropriately. And that's exactly what I'm going to do. I'm going to use it for children. Thank you so much. Have a great day, and call us if you need us.